All right, so today I'm gonna walk through an adjustment and what that looks like. This is Anne-Marie. So before ever getting her on the table, we do a new patient exam, consult, do some x-rays, go over those x-rays with the practice member. To my left is a computer that has her x-rays up. Unique case here, we have a cervical block fusion, more congenital, so it's not a surgical block, it's just a congenital block that she has. One of her concerns coming in was around that area because she was told previously not to adjust it, which is good. You don't want to adjust block segments, but we definitely need to work above and below those segments. We've seen her range of motion improve. We've seen just the tension and the stress in her upper back and neck improve just by working above and below that fused area. The other thing too is the hip. So when I go through this approach, I'm going to kind of walk you guys through how we're going to get the hips moving, and then the neck, I'll show you how we adjust specifically for a spine that has these elements, okay? So first things first, and just breathe in, let it out. Breathe in and let it out. Good. Breathing helps that practice member relax, so we're going to start there. Going to just take your knees, come up. Good. So the right side's tight. We know that she has some right rotation into the hip. This side is higher, just seeing from the laying down position. So we're going to start off in the pelvis, do some simple drops, and then we're going to work our way through the spine. Breathe in, let it out. So we're doing a mirror image approach here. So because her right hip is behind the left one, we're pushing straight down through this hip, putting mobility into these segments. When I push through this joint, do you have any pain?
No.
No? How about this side?
Just a little.
A little bit tender?
Yeah.
How about above it? Any tenderness?
No.
Good.
It used to be very clear.
Yes, it used to be.
Yeah.
It used to be.
Yeah.
Face me this way on your side. So now we're going to do a side posture adjustment here. On this one, I'm going to use a drop assist. So knowing Anne, the more force doesn't make an adjustment better. So what we're going to do is we're going to raise this table up. And what that's going to allow me to do is go lighter with my body through the adjustment and allow the table to do some of the work for me. I am going to put a little bit of rotation. My chest is then going to go right through the hip. Good. Go face up. So as a chiropractor, we're always hanging out at the bottom of the table towards people's feet. What we're looking for is balance. And so the balance gives us into the next read as far as where we're going to go with adjusting. Turn your head to the right, Anne. Turn your head left. So range of motion less to the left. And so how we're going to set this up, we know the lower cervical based off of the x-rays is an area that we're going to stay off of. And then with the adjustment, we're going to go straight through the joint. Let that fall. Good. Good, look up. Good. Now on her cervicals, it's not a huge motion. It's very gentle. It's very specific. A lot of it's going to be surrounded around the upper cervical because we know the lower cervical is the area that we're staying off of. In this case, we're going to do a little bit of extremity adjusting. So we are going to work on the right knee. We're going to bring this up. And I know the hips and the knees were a big area, and still something that we work on consistently with Anne-Marie. And then we're going to do an ankle adjustment here. Relax, breathe in, and let it out. Good. Relax, breathe in, and let it out. Okay. Bring this up. So on a knee, we're looking for flexion. So it's a hinge joint, should be able to move up and down rather easy. In cases where we're really diving into a chief complaint of hip pain, it's really important that we check the extremity as far as bottom to top, making sure the ankle, the knee, and the hip are all moving the way that they need to. Good. Come sit up for me. Turn that way. So this next one as well, so working with Anne, knowing the history, I like to adjust the shoulders so she sits for work at a computer. A lot of times the shoulders will go forward. So what we want to do is put your hands on your hips. Push your elbow back. Good. Push that elbow back. Good. And then left arm up. Good. And then fall into me. Good. And then right arm up, and you're gonna fall right into me. Good, and drop that. And then I'm gonna grab the artier stim. Kind of walking through the artier stim, percussion. This machine is great for areas that we can't put manual force through. And so what you're gonna see is we're gonna place it on that lower cervical. My hand is gonna mirror image again the posture. So instead of being forward, we want her head to sit back. It's nice and gentle. Most people say it just rattles their brain a little bit. Look down, so flexion. And then look up. Look down. So we're gonna bring her through the range of motion 2 or 3 times. Look up, look down, and then look up. Good. The last thing we're gonna do is just check range of motion left and right. Turn your head left, and then turn it right. Good, and look straight. Great. That's an adjustment. Good job.
Thank you.